So have you ever noticed that after surgery, the brain fog has gotten better or worse?
Oh yeah, I think many
Pain
patients.
meds being used, and then there's actually a question specific to the medication Concerta, which is a sort of ADD medication. So I wonder if you have any comments about that.
Well, you know, these medications are stimulant medications, which kind of counteract sedative medications. So it makes sense that people will be a little quicker on the draw. In fact, they did a study. It's kind of comical in a sense. They did a study of medications that you know, are used for stimulant medications and gave them to air traffic controllers, and they all actually were much better at air traffic controlling. So the question came up: should they all be on stimulants or not? Or should we all be on stimulants, or should we put it in the drinking water? You know. So some of these things, you know, it's not surprising that they improve function in someone with a chronic headache or chronic pain, or that's on sedative and other medications that may make you a little more dull-witted as you undergo continuous treatment. But we try to stay away from narcotic medications, for instance, and these stimulant medications in particular, because they produce a conundrum of problems that just aggravates things as time goes on. So there's no place for them really in the long run. The treatment for Chiari headache is medical treatment, which is not usually long lasting and is not often 100% effective. I mean, Dr. Miller, when he used to talk, he would kind of chortle, you know, that you know, I was dabbling with these silly medications when what these people really need is surgery, you know. So, but it was true, you know. I mean, patients would come around, they would get some relief. I have patients that did well on some of these medications for 5 or 10 years, but they ultimately, the natural history of this is to come to surgery at one point or another. There's certainly, I mean, we have patients that have suffered with Chiari for 30 or 40 years and, you know, somehow get by without surgery. But don't forget, as you pass 25 years of age, your brain begins to shrink. And by the time you get to be 65 or 70, there's a lot more room up there. So you don't tend to have as much pressure-like problems, and the tonsils gradually lift. In fact, some of the work that Dr. Keating's done with looking at tonsillar herniation from the teenage years into the early 20s and 30s, you know, your tonsillar descent sort of peaks in the mid-teens and the early and really late teens, maybe early 20s, and then as after you're 20, you begin to lose, I don't know, something like 100,000 neurons a day, and your brain begins to atrophy gradually, and that sort of lightens the load on the Chiari problem. Tonsils, with if you monitor them in a natural history of things, they begin to elevate somewhat. So this 5 millimeter rule is, as Dr. Keating talked about today, is really a bell-shaped curve. You know, it's the margin at which less than a couple of percent of 1 or 2% of people, you know, have tonsils that are that descent. So you can be normal and have tonsillar descent of 4 or 5 millimeters, or you know, you can be have Chiari. Now, tonsillar descent by itself does not oftentimes indicate the amount of lateral tonsillar compression there is. You know, so you want to get a good look at all the imaging that's available. So, and axial imaging of the craniocervical junction, because in a number of patients there's lateral impingement on the tonsils, compressing the brainstem laterally, which can you don't see in the central cut of the usual demonstration of the tonsils. In fact, the tonsils are a little on either side of the midline, you know, but we don't tend to see them a degree to which tonsils can wrap around the brainstem and produce lateral compression, which can have a lot more impact on things like vestibular function, hearing, and other things like and sensory function, you know.
Yeah.
So,
kind of before we get away from the medication questions, there was a question that someone's child had been given basically an antihistamine for debilitating headaches. Is that something logical that would work, or is there some
I
reason?
don't see that being of any particular benefit. I mean, if patients have Chiari headaches, I mean, Diamox can be used in youngsters as well as teens and adults, and does produce some, relief of those of chronic headaches. It's used in pseudotumor a lot, which has many resemblances. So you can have pseudotumor and not have Chiari, all right? But if a pseudotumor complicates the Chiari process in a number of circumstances. So the treatments are kind of the same. The causes of many of these things are multifold. The treatments are meager. There's really an armamentarium aside from surgery is Diamox and methazolamide or Neptazane, which is a little bit longer acting, and Topamax. All right, Topamax has become the migraine doctor, the headache clinic's silver bullet, because almost everybody is placed on Topamax. Topamax has a use in migraine. They don't think about it in affecting intracranial pressure, but it does have a carbonic anhydrase effect like Diamox. And I think a lot of it may be relieving mild increases in intracranial pressure. But Topamax is used in migraine as an anticonvulsant because there's a theory of migraine that says it's aberrant discharges from the hypothalamus that lead to the spreading activity in the brain. That's what's migraine. We know darn little about migraine presently. Even there's still a big discussion about whether it's vasoconstriction, vasodilatation, or really a hypothalamic discharge of spreading depression that causes problems that affect vision and other things. So migraine is still not very well understood. It's amazingly as common as it is.
Yeah.